Welcome back to the Dr. Somji Skin channel. I've got my trusted colleague here, Dr. Tino Solomon, or should I say Dr. Valentino Solomon, as he sometimes likes to be known. He's been working at Dr. Many Spa for a number of years dealing with skin. We see a lot of patients together, but today's topic is his speciality. It's pigmentation.
Indeed.
So in clinic, what treatments do you start with? Say if someone has mild pigmentation, we're talking about like chemical peels here. So chemical peels that you can get done with your esthetician in clinic. What are the mild peels that you would use?
Okay, so if somebody comes in with mild pigmentation or pigmentation that they anticipate might get worse and they want to sort of prevent that from getting worse, I wouldn't jump straight into going very potent with any treatments. I wouldn't go in with any sort of aggressive treatment. But you can start with something very simple like kojic acid. Kojic acid, as you mentioned earlier, very good tyrosinase inhibitor. Some of the treatments you can do which are slightly milder than the more aggressive treatments that can be performed in clinic. For example, you can do mandelic acid peels, the tranexamic acid peels that we talked about as well.
Yeah.
And those can be done with minimal downtime and minimal trauma to the skin.
Mandelic one's a really popular one,
very popular.
or like darker skin type.
Yeah.
Sometimes when you do, say, a slightly stronger chemical pill called a jasna pill, which is a mixture of salicylic acid, lactic acid, and resorcinol, that can be a bit strong initially. So using a mandelic acid pill, you can actually get a nice brightening effect, reduces the inflammation as well. And it's a great way to enhance that foundation and also build your skin barrier so you can get more aggressive treatments in the future.
Yeah.
One thing that I will say, which I see a lot on social media, is just using microneedling alone for pigmentation.
Yeah, I'm asked this a lot in clinic. And for every reason we've talked about, it's, in fact, if anything, I've seen worse pigmentation after microneedling.
Like, just anyone that advises that is just so wrong.
Yeah.
But let's just curveball this, because we can't completely knock this, right? Because
well, we can break it down.
So if you microneedle just to channel, so create channels, and then you put all this lovely tyrosinase inhibitors on as a serum, you're gonna help, yeah? But just microneedling alone, just with something like hyaluronic acid, or just with PRP, for instance, so platelet-rich plasma, which some of you guys might know about, that's not gonna help pigmentation. So, I think that, people, you can save yourself a fortune not doing that. Doing simple chemical pills like mandelic acid pills, jasna pills, even mild TCA pills, chemical pills, under the right instruction, can really help with pigmentation.
And I also believe that it will potentially make pigment worse, because if microneedling is done quite aggressively, you cause more inflammation in the skin. The inflammation will trigger the inflammatory process, which we talked about. The inflammatory process will trigger the melanin cells, the melanosomes, to produce melanin, and there you go. You've gone in to have your pigment treated, and you've ended up with worse pigmentation.
Yeah, so like some people come and see me and they say like, I'm coming to Dr. Many Spa because you understand skin and color. And I say, what makes you think that I understand skin and color? Is that because I'm brown myself, right? But that doesn't mean that just because just because I'm brown doesn't mean that I know how to treat things. It's about experience. It's about knowledge of knowing how to prep and all these sorts of things.
It's about understanding the pathways.
It's understanding the pathways. So if someone says, come in, you can go and get this done. We'll take the pigments away with a laser, which we're going to come on to. And you've got you tan in the sun, so it doesn't even have to be skin like mine. Even if you tan in the sun, and if you do tan in the sun and they say yes, you can just blast it away in one go, you know that they are talking. Okay, so that's it from us. If you have any questions about pigmentation, just pop it in the comments below. Don't forget to click that bell button, which basically alerts you when new kind of exclusive videos come in. If you want us to talk about anything special, just let us know. But that's it from us today. Thank you so much, Dr. Solomon,
Thank you, Dr. Somji.
Speak to me.
Pleasure.
More to come, right?
More to come indeed.
Yeah.